Hi everyone, welcome to Exercise Prescriptor. The objective of this video, what is Exercise Prescriptor? Is it Exercise Prescriptor confusing the young generation to not use electrotherapy or any other passive options? Is it we are against any other passive option or else we are only doing exercise? Let me answer. So what I'm trying to convey here is in physiotherapy practice in this world, we respect highly each and every individual perspective and their opinions. But the problem here is when the patient comes to you, we are not putting so much effort to understand or diagnose or question what it is. Okay, directly we are jumping into the treatment methodology because if there is a knee pain, the same three exercises as a home program, the same modalities. If it is back pain, the same thing which we are following. Not everyone practicing in the same thing, but 95% of the physiotherapy clinics and hospitals are running like that. The problem in the hospital, getting less salary, want to work throughout the day to see many patients, the environment doesn't support. We can't come out of the passive movements and ankle turn movements, breathing exercise, and mobilizing the patients like walking and chair shifting something if there is a neurological patient. Apart from this, we can't push ourselves because of the salary and other factor. Because the one person has to see 10 plus patient a day, it's tough job for them. So considering this, whoever comes to us or any other clinics, if you ask what is physiotherapy, they're not coming out of the modalities. That is where I'm asking to stop because something's there to reduce the pain. Something is there to reduce the pain. Then what is your role? Your brain doesn't work to think beyond. And I have seen this quote many times. Exercise is one of the best source of treatment, but exercise is not the only treatment option too. So we are not only practicing exercise to cure the patient. So strongly we are believing it is not about the pain, it's all about the individual who attached to it. It's highly vary. The same pain, if you give me 100 people with the same diagnosis, I'm damn sure that all the 100 people will not say the same pain intensity. All the 100 people's treatment goal may not be the same. All the 100 people age, physical activity status, previous pain experience not be the same. So considering this factor, it's all about the individual who wants to treat, who doesn't want to treat. Because may I have 5 out of 10 pain, I can manage myself. After 4 days, my pain is gone. May I can't manage myself, 5 out of pain, I'm taking treatment to others. So it highly depends on the individual oriented approach along with that the biomechanical factor which is happened or which is caused the pain. And most of the cases are coming like overloaded or underloaded. I was very sedentary, I'm not even moving much, end up having pain. I was moving or doing something beyond my capacity. So I'll always say this to everyone. So just consider you have a capacity to lift only 10 kg. If you try to lift 50 kg, definitely you will end up having pain or any structural damage. If you have a capacity to lift 100 kg, at the time if you lift 50 kg, you will not end up having the structural damage. So considering this factor in your mind, okay, most of us nowadays are coming pain with the overload, underload structure, improper workload management. So many things comes to mind. I'm not saying this is the only reason for the pain. This is one of the most common reason for the pain. So go behind the person goal and need why the pain is coming. If I ask the patient to move, for example, aggravating factor of the pain for everyone is same nowadays. Nowadays, for aggravating factor is movement, then what is the point of treating the person in lying position? So I have pain during stair climbing on my knees. Making the person to sit and giving ultrasound, how it makes better? Even though it makes better, it is only temporary. You're wasting your 15 minutes. Okay. Instead, what was the reason actually? Try to spend the 15 quality minutes to the patient and understand and work on some muscle and increase the movement strategy. Is it the patient problem from the mind? Every chronic pain starts as an acute pain. Chronic pain starts as an acute pain because first consultation, first treatment, any doctor, any physiotherapist are seeing the person, they're not able to give 100% improvement, some misinformation, the patient increasing the fear, that leads to chronic pain until some specific chronic conditions like inflammatory condition, osteoarthritis or some other. So there are chronic conditions also there to cause pain chronically. Apart from that, why so many acute condition? It's going to recover within few days. Like ankle sprain patient come, we didn't rehabilitate properly, giving false information leads to person have ankle pain and chronic ankle instability for the next 5 years. For shoulder pain patient coming, don't lift your shoulder. You had impingement. You're saying the terminology increasing the fear to the patient, and the person is not lifting the arm for next 1 year, even though we are reducing the pain. The pain is continues to stay in the person's body. Nowadays, the peoples and persons are believing I don't have pain, so I'm all right. I should not do that activity. But that is not a successful treatment. It is not like the absolute successful treatment is what you want to do successfully at the end without having pain. That is considered to be a successful treatment. So considering that, I'm not against the passive options. The person pain have very severe, you don't have confidence to just give the movements, 10 out of 10 pain was there, absolutely fine. Give some modality IFT or something for 10-15 minutes, it's absolutely shock wave for 10 minutes, absolutely fine. But what is happening in clinical practice? We are not going to ask the patient to move. We are giving only modalities for throughout the 45 minutes. In last 2 minutes, we are asking the person to move. In my every educational class, I'll ask the therapist to do movement. How many physiotherapists knows to perform the exercise correctly? For example, I will ask you, which is the best exercise for gluteus maximus in clinical practice? Everyone says glute bridging. So most of us comment on hip bridging. I'll ask you to do hip bridge and you do hip bridge and let me know which muscle you are feeling. Half of them will feel hamstring, half of them will feel quadriceps, half of them will feel lower back, half of them will feel glutes, half of them one side will feel more than the other side. Everyone is not feel the same glute. If you make the person to do bridging in your session, and if you ask the person where you're feeling, the person, your objective to activate the glute, but the time person is not activating the glute, then your brain actually thinks, oh, what is the mistake mechanically, is that biomechanically and liver system, so many things you think. And you try to change what is the problem on the patient, what is the problem on the movement, did I give any cues properly, did I activate, stimulate properly? So many things comes in your mind at the time. Then you will give better results to the patients. The same applies to the back pain patient, you are giving cat and camel. What if the person can't even go for the lumbar cat and camel home program? They will do the thoracic cat and camel. They need to come on thoracic and hip, and they will come. I did exercise. I'm not feeling any improvement because the person is not did perfectly. How many of physiotherapists of us is doing exercise regularly? Is it okay when cardiac surgeon says, I don't know how to handle the scissor or knife? Is it okay some electrician still that I don't know how to climb the pole? Absolutely not okay. In the same sense, being a physiotherapist, being a physical therapist, we don't do exercise at all. Here, 20% or 10% passive option, 80%, 70% movement oriented approach and understanding individuals and getting a belief from the person and achieving towards their goal, movement orientation helps to improve the person. Okay. Not only doing passive movements, but my problem is everywhere they're practicing 80+% of these passive options, only 10% of this other things. How drain healing cuppings comes into physiotherapy, guys? When I studied, it was not at all there. So we are going into the insecurity. That time we are feeling only pain is the ultimate goal of treatment in physiotherapy. Then someone is come with a solution. Drain healing helps to reduce the pain. Cupping helps the pain. Taping helps to reduce the pain. We are following that blindly. We forgot that ultimately we study to improve the person quality of life, not only the pain. This is where the problem is. Just I explain whatever is there in my mind. No, okay. I don't know. I was explaining everything in a right track or right tone, or I give proper conclusion. But this is what my statement. This is how we practice. And for your kind information, in exercise prescriptor, we are often educate the person to be physically active. We don't tell the patient to be stop doing something until it's required. We don't increase the patient fear. We give right education to the patient about their condition. When it comes to education, not explaining all the scientific information to the patient about how long it takes, giving realistic information to the patient. We try to understand the individual maximum, why they are coming here for, what is their objective to come here, how can we help them. So we will always look into that. We work towards the patient. Again, I'm saying it's not about the pain. It's all about the person who attached to it. It's not about the ACL injury. It's all about the person who attached to it. It's not about the ankle sprain. It's not about the back pain, neck pain. It's all about the person who attached to it. Just keep that in mind always and don't over rely on this passive option. That is my absolute aim. To improve physiotherapy career, physiotherapy practice, rather over relying on the passive option, just one day in your clinic. Just one day in your clinic, stop using this passive option completely. Just try to think how I'm going to improve the patients. Actually, you feel your brain started to think. Plenty of questions will come. Half of the question may not answered. Go and search for it. Learn. Hopefully, this video gives some more clarity to your mind. If you have any doubts, you want to ask me something, just drop the comments. We'll come up with a second video to give more clarity. Happy learning.